My name is Chad Clark. Came into physical therapy. I was playing with the LV Steelhawks. I ended up completely just destroying my right shoulder, completely tore the subscap and most of the labrum. Continued to play on it for about 5 more games, and then, it had to be fixed.
I'm Greg Carolyn, one of the orthopedic surgeons here at St. Luke's. I had the opportunity to take care of Chad Clark when he sustained a severe shoulder injury while playing professional football for the Lehigh Valley Steelhawks. Chad sustained an injury to his subscapularis tendon. It's one of the 4 tendons that make up the rotator cuff, and most would argue it's the most important tendon in the shoulder. He sustained a complete rupture. The entire tendon pulled off and it retracted back by about 5 centimeters. This was a near devastating injury to most patients' shoulders. We were able to restore the anatomy of his subscapularis by repairing this arthroscopically in a procedure that was challenging but very successful.
Going through St. Luke's for my shoulder surgery, I had Dr. Carolyn, who's probably one of the best shoulder guys in the valley. Did a phenomenal job with everything he had in there. I mean, you talk to him yourself. I mean, he really put some work in that day. Did my physical therapy over off Illick's Mill with Tim Miller. I believe the two of them really coordinated together, put a great game plan together with, getting my therapy in line and getting me back to where I need to be.
Well, Chad had a torn rotator cuff. Dr. Carolyn over at St. Luke's did his surgery, and it was a pretty massive tear. When Chad came in, the first few weeks, all we could do was passive range of motion to try to restore some of the range of motion in his shoulder joint. After about 6 weeks or so, we were able to go through and start active movement where Chad would lift his arms up on his own and try to regain some of his strength that way. Around the 3-month standpoint is when we really started the strength training. We started with light TheraBands to begin with, and as his strength progressed, we progressed to heavier weights. We utilized our KinCom, which is isokinetic strengthening, and by the time Chad was done, we were able to go through and be able to throw different weighted balls, footballs, and things like that to try to get him back to his previous level of activity.
I played my college ball locally down at Moravian College. I had a good 4 years there. Came out of college, played a little bit of minor league with the Scranton Eagles before I got into the Arena Football League in 2000. Traveled the whole East Coast playing for teams Georgia, Carolina, Virginia had a team, and upstate New York, and then Wilkes-Barre. Finally came back to this area and played for Reading, and then right over in Jersey for a year. And the AIFA were those 2. And then the IFL the last 2 years with the Steelhawks here. I have 6 championship rings in my career. And in my whole, like I said, my whole entire pro career, the 12 years I played, only the last 2 years were the injury prone, when everything started breaking down. So I was blessed with a good career with very few injuries. The physical therapy experience I had here was top notch. I was treated, extremely well. They definitely worked with my schedule, fitting me in, 3 days a week, 6 months. I mean, I was here a lot, so I got to know the staff real well. I would recommend St. Luke's physical therapy to my friends, family, any other athlete in the area looking to get back into the game.